Humans have been manipulating their breathing for thousands of years, with many cultures referring to the breath as the life force. Looking at the evidence, it is easy to understand why. Our breath can deeply affect our physiology, our consciousness, and even our whole perspective on life. It is very exciting that breathwork is becoming more popular as more people around the world realize the amazing power of the breath and discover that they have the complete ability to heal themselves from within. Breathwork is a powerful practice with ancient origins. In this video, we're going to look at a brief history of the practice and gain a basic understanding of the physiological effects from the practice of breathwork. Breathwork is a name for the practice of deliberately manipulating our normal breathing for therapeutic purposes. Breathing practices and techniques are a core part of the Indian yogic tradition, which dates back thousands of years. Various breath practices have also been used by other ancient cultures such as the Native Americans, Hawaiians, Inuit, Tibetan and Burmese Buddhists, Taoists, Sufis, and likely many others around the world in order to reach altered states of consciousness, allowing deep meditation, peace, tranquility, inspiration, insight, and a feeling of greater connection to life as a whole. In yoga, breathwork is known as pranayama, with prana meaning life force and yama control, literally meaning control of the life force or vital force. These pranayama techniques have been practiced for thousands of years on the Indian subcontinent and were first compiled together in the Yoga Sutras of Patanjali between 500 and 400 BCE. In recent years, breathwork has been gaining a lot of popularity as a way to de-stress, release anxiety and depression, deal with difficult emotions, process grief and trauma, and just to relax deeply and let go of the weight of life. A lot of the practices you see today are based on or are very similar to the ancient teachings of pranayama. Let's take a look at some of the evidence of how breathwork can help us. We'll start with an understanding of a very important nerve in the body, the vagus nerve. This is the nerve for mind-body connection. It connects the brain back and forth between the heart, our gut, and even connects to our immune system. When you hear about mind-body practices, they're really working on strengthening this nerve. The vagus nerve is responsible for the communication between many parts of our body and the overall balance of our nervous system. A common measure of the strength of the vagus nerve, or vagal tone, is heart rate variability. Our heart rates go up on the in-breath and down on the out-breath. You can test this out yourself. Find your pulse and take a deep breath in. Slowly breathe out. Repeat this a few times. Can you feel your pulse change? Heart rate variability is the measure of this difference in heart rate on the in-breath and out-breath. Improved heart rate variability is an established indicator for greater control over the nervous system, meaning you can more quickly and effectively move from sympathetic dominance, basically the activation of the fight or flight nervous system response, to parasympathetic dominance, activation of our rest and digest nervous system response. Vagal tone is also an established protective factor for heart attack and stroke, meaning that among the many benefits of breathing, it may also help reduce risk of some of the biggest killers in Western society. But that is a topic for another video. So how do we actually strengthen the vagus nerve? Practicing slow breathing. Just 10 minutes a day has been shown to have lasting benefits for many medical and emotional disorders, including depression, anxiety, and even PTSD. Slow breathing has also been shown to lower cortisol levels, which is a biomarker directly associated with stress levels. If you want a guided practice of this slow, deep breathing, check out my video 10-minute breathwork to relax and release stress, anxiety, and depression. So we've looked at slow breathing. Let's now examine some faster breathing techniques which are also found in the yogic tradition. Similar techniques have also been used in many other cultures around the world to reach altered states of consciousness, and are used today by therapists, coaches, and healers to support psychological healing and optimized physical performance. When you breathe quickly, the greater volume of air moving through the lungs allows the increased diffusion of carbon dioxide out of the body. Normally, the blood maintains a close balance of oxygen to carbon dioxide, giving the blood a stable pH. This is because carbon dioxide is acidic. When you practice more intense breathwork, your body's balance of carbon dioxide to oxygen temporarily shifts to a lower concentration of carbon dioxide in the blood, causing the blood to temporarily become more alkaline. This can explain some of the physiological changes experienced, which are called alkalosis, commonly tingling or numbness in the hands and feet or ringing in the ears. In the past, there was some concern in the therapeutic field that these symptoms of temporary alkalosis can be harmful. However, research has revealed they are harmless in healthy people. In fact, a recent study of over 11,000 people doing intense breathwork practices for over 12 years found not a single adverse physiological reaction. Another study on these more intense breathing techniques found that after a single session, practitioners had significant improvements in their heart rate variability, which, as we discussed earlier, shows a greater control over the nervous system, leading to a significant reduction in anxiety levels, which are largely caused by dysregulation of the nervous system in the first place. If you want to learn more about the evidence of how breathing can help with anxiety, I have a whole video about that. High-frequency breathing may also help to increase something called brain-derived neurotrophic factor. Brain-derived neurotrophic factor helps with the creation of new neurons, the repair of old neurons, and neuroplasticity, which is the brain's ability to change. This is important for all of us, but especially important to help reduce brain aging as we get older. There is also evidence that breathing can help with improved mental clarity and function. It seems that breath practices, whether slow and relaxed or more intense, may be effective in increasing the strength of the vagus nerve, improving heart rate variability, and increasing parasympathetic control. Basically meaning we can relax more easily and enjoy the many benefits that follow, including lowered levels of anxiety, stress, depression, and potentially even lowered risk for cardiovascular disease, as well as improved mental and physical performance. Cerebrospinal fluid is a fluid that is produced in our brain and moves through the brain and down the spinal cord. Cerebrospinal fluid. It is responsible for the supply of nutrients to our neuronal cells in the brain and glial cells, which are the cells of our central nervous system. They're very important cells. The cerebrospinal fluid also transports hormones and neurotransmitters through the central nervous system, as well as removing waste products. One of the main influences of cerebrospinal fluid flow is the breath. Stress and anxiety tend to lead towards a restriction in breathing, leading to a reduction in cerebrospinal fluid flow. When cerebrospinal fluid doesn't flow effectively, well, you can imagine the health effects of not having sufficient nutrients in the brain. One proven way to increase cerebrospinal fluid flow is through the conscious deep breathing we have discussed. When we breathe deeply, the pressure on our abdomen from the breath acts almost like a pump for our cerebrospinal fluid, helping to increase cerebrospinal fluid flow and to experience all the health benefits that come with it. Now we have a basic understanding of how the breath can affect us physiologically. Check out my other video, Breathwork, the Science of Healing Stress, Anxiety, Depression, Trauma, and more, for an understanding of the evidence of what these physiological changes actually mean for our psychological well-being, healing, and life satisfaction. Or if you want to experience these benefits for yourself, try one of my guided practices. 10-minute breathwork to feel amazing, or 10-minute breathwork to relax and release stress, anxiety, and depression.